My name's Anita Krishnan, and I'm the clinic director at Cal Rehab in San Clemente, and I'm originally from Cleveland, Ohio, but I've lived in California now about 4 years. I think when someone is in pain, it's the best time, especially if it's musculoskeletal pain, to try physical therapy. A lot of the techniques that we use encourage the body's kind of natural capacity for healing. So it allows you to avoid using pain medication, to have to consider more invasive treatment options that often give you maybe some short-term benefits, but still have a lot of long-term disadvantages that you have to kind of contend with. So choosing PT for pain allows you to really do a lot naturally and use the tools that your body already has to help heal. Physical therapy is actually the best option for you, especially in the case that you've had a surgery postponed. So it can do a number of things for you. We see that people who have done prehab or gone through a physical therapy plan of care prior to their surgery tend to have better outcomes. They go in with better mobility, decreased inflammation, better strength. And then I think you also have an awareness then of what some of the exercises might look like after surgery. You're already kind of familiar with physical therapy and what we do. And so just even from a psychological standpoint, it allows you to dive into your rehab after surgery with a little bit more ease and less concern, especially if you're meeting that therapist before your surgery and developing a relationship with them already. We see that has a huge impact on your outcomes. And so even if your surgery isn't postponed, physical therapy is a great option. So in the event that it is postponed, spending that extra time, actually being able to manage your pain, work on your mobility, and work on your strength is going to be really, really beneficial to your ultimate outcome. The best way to know if you need a referral for physical therapy is to actually contact your insurance directly. So there are insurances that allow you to see a specialty provider without that primary care physician's referral, but it is limited. And so asking your insurance directly is the best way to find out, but we also offer, when you call to make your appointment, we can do that insurance verification for you as a courtesy, but then we do recommend that people cross-check with their insurance as well to make sure we have the correct information, but that is absolutely available to you. The primary goal with physical therapy is to improve quality of life. And so on your first PT session, we do a lot of discussion about what your goals might be. And your goals can be as simple as hiking on the beach trail or walking with family members or getting down on the floor to play with your grandchildren. So it doesn't necessarily have to be really high-level goals. It's whatever goals are important to you in your life. We want to be there to make sure that we can make an impact in improving whatever quality of life looks like for you. So that can apply to all of us. The primary goal of physical therapy is to improve quality of life. So really it's about what quality of life looks like to you. So it can be as simple as, wanting to be able to get down on the floor to play with your grandchild or taking, a walk on the beach trail every single day. So it doesn't necessarily have to be these really high level or high activity goals. It just has to be meaningful to you. And so on your first PT visit, we spend a lot of time discussing with our patients what their PT goals are and what an improved quality of life might look like for them. So yeah, PT is absolutely, something that all of us can benefit from. My route to physical therapy was a little non-traditional. I actually started out in engineering school, and I got about 2 years in, and I wasn't loving it because I was slowly realizing I wasn't going to have a lot of person-to-person interaction with what I had chosen to pursue. But we had a prosthetic and orthotics class. We had a prosthetic designer come in with a therapist, and it was the first time I learned about rehab and physical therapy, and the therapist was talking about her role in using this prosthetic to get a patient walking again for the first time since their amputation, and what a life-changing kind of impact this woman was having on these patients. That really struck me. So I ended up dropping out of engineering school and switching into like a pre-physical therapy program, and I'm here now. I think the best advice I could give someone that's thinking about pursuing a career in physical therapy would be to spend a lot of time with physical therapists and in physical therapy settings. So most of our facilities take volunteers, and so whether that's shadowing a PT in a hospital setting, in an outpatient setting like ours, whatever it might be, just getting as much hands-on experience as you can, seeing what these PTs are doing day to day, it will really allow you to understand kind of the ins and outs of what a day in the life is like, and allow you to make a more informed decision about whether it's something that you want to pursue.